Thank you for tuning in to Love in Your Hands with Cynthia Clark, the podcast about how to live life with love, passion, and purpose. This podcast is sponsored by loveinyourhands.com, the place to heal your emotional past, identify real compatibility, and find long-lasting love through the merging of ancient science, modern technology, and quantum physics. Tired of superficial connections? Start your free Soulmate Connection membership today at loveinyourhands.com. Now here's your host, Cynthia Clark, palm reading consultant, compatibility expert, and heart harmonizer. Hi, everyone. Thank you so much for joining us today. I'm Cynthia Clark, and I am excited to share some really important information with you today. And we're going to start out with a very short little palm reading because that, of course, is what I do. And you can actually see addictive behavior in the hands. So there is a line that shows up in what's called your Luna mount. Okay, so if you look at your hand, it's going to be down here in this section of your hand. So it's opposite your thumb ball, way over here at the lower part of your hand. So Luna represents your subconscious, and it tells you, how you're connecting to your creativity and your intuition. It's also your sacral chakra, so it's like your area of receiving. But when we have these lines, and they're going to be horizontal lines that come across this section, that actually shows restless energy, okay, which can be, I actually have a couple of those, so ties in with my fire hand. But if you have that in an extreme fashion, this can create addictive type behavior. And so the line would actually come all the way across the hand, and it would actually cross over the lifeline. And that type of restless line actually doesn't happen all that often. So when you see that, it's definitely a sign that you've got some addictive behavior, addictive personality that you might want to remedy or just get checked out or work with somebody like who we're going to introduce today. So anyway, I'm so happy you're here, and I'm really excited to bring on Dr. Bill Bergman. He is a magna cum laude, Phi Beta Kappa graduate of Amherst College and a graduate of Columbia University College of Physicians and Surgeons. He's also a member of the International Fellows Program at the Columbia University School of International and Public Affairs. He's been involved in practicing holistic medicine and stress management for close to 50 years. Wow, so much amazing experience. So thank you, Bill, so much for coming on the show.
Oh, absolutely. I'm so happy to be here with you, Cynthia, and be able to hopefully be of help to your audience.
Yeah, thank you so much. Yeah, I mean, addictions are so difficult to deal with. I look back at my marriage. I was married to a guy for 19 years who had kind of an addictive personality, just like that line I was describing in my hand. And, he dealt with it really well, but it was difficult. And I've also had friends over the years who have had, different types of addictions. And it's just like, it's so, you almost don't know what to do for them because you're kind of standing on the outside and you want to help them, but you watch them self-destruct, and it's heartbreaking. So why don't you tell us a little bit about how you got into doing what you do now?
Well, I went to the medical school at Columbia University with the intention of becoming an eye surgeon. They have a great eye institute, and that was my plan. But even as a medical student, I began, questioning why we get sick, particularly chronic disease. In other words, where it's not an injury, it's not an infection, but, the chronic ongoing diabetes, heart disease, all of these kind of chronic problems. Why? I mean, I felt that the human body is such an expression of our Creator's unbelievable intelligence and wisdom, and every part of the body, every organ, every tissue, even every cell is a miracle of creation. And I began examining the impact of nutrition, actually. But then the most important thing is when I became a third-year medical student, we left the classrooms and we went actually into the wards of, at that time it was Columbia Presbyterian Medical Center. And I had a medical preceptor. This was an older professor of medicine who had a group of us third-year medical students, 7 or 8 of us, and he'd bring us around the hospital and meet his patients. He was a specialist in rheumatoid arthritis, a type of autoimmune disease, which, of course, it means the body forming antibodies that are normally protective against its own tissues. And he was doing some of the leading edge research on autoimmunity and rheumatoid arthritis. And one day he gathered our little group of third-year medical students, and this was after he had brought us to meet the patients, to do the physical exams, to analyze the laboratory work. And he said one afternoon, "Never forget that this is a psychosomatic illness." And I was absolutely stunned. Psychosomatic. To me, at that point, it sounded like, what, he was saying that people imagine this disease, it's somehow in their mind? He went on to explain that psycho means mind, somatic means body. There was a mind-body connection, and that unless we would look at the deeper sources of a person's life situation, the stress, whatever, that it'd be hard to really understand how to be of help to a patient. And that just changed my career path from eye surgery to holistic medicine.
Wow.
Yeah, and in any case, that's how I got interested in, first of all, the whole issue of a holistic approach to chronic disease, and we now call it integrative medicine. But I began to focus especially on stress, because stress is one of the major drivers of chronic disease through, actually, it's an ongoing low-grade chronic inflammation that really is behind virtually all chronic disease. And one of the major drivers is stress. And I began to focus more and more on that. And then from that, I began to really look at destructive habits and addictions as a subset under stress, but something that obviously has just been growing, unfortunately, leaps and bounds. People have just all kinds of destructive habits and addictions. And that's been my focus.
Yeah, that's amazing. Yeah, when you talk about the psychosomatic, that's so interesting because you know how they talk about the placebo effect, and it's like, if you believe that you're going to get better, 30% of people get better, or I don't know what the stat is, but it's pretty significant.
Absolutely.
And if you will yourself to be, like, oh, I'm going to get this sickness, or, oh, it's, this is what drives me crazy, people who call flu season, like, oh, I'm going to get the flu, it's flu season. And it's like, why do you even believe in flu season? Like, stop it. And I'm one of those people who's the opposite. I'm always healthy. And I believe that I will always be healthy no matter what. And even if I get something, or if I start to get sick, I'm like, oh, I'll get better. My body knows how to rejuvenate.
Yeah.
So but yeah, you have to keep telling yourself those things too. And don't buy into all of that fear-based stuff. So what would you recommend? Obviously people have a ton of stress in their lives. What would you just recommend as far as like identifying the stress and maybe ways that they could start to eliminate it?
Well, the thing is that for years, when I was kind of focusing on stress in general, I really began with explaining to people the difference between a stressor and the actual stress response, which is what we experience. We experience stress as a feeling of tension. We all know what stress feels like.
Yeah.
But the stressor is the trigger. And a lot of times there's a misunderstanding that the stressor is actually causing a stress response.
Hmm.
But it turns out that that's not true. What we're experiencing is our mental and emotional, our thought and feeling uh, interpretation of what's happening to us. This is why, you know, two people can be exposed to the same stressor, and one, I'm thinking of, for example, cancer. I mean, Dr. Bernie Siegel, very well known, actually, he was a surgeon at Yale. Um, he talked about his exceptional cancer patients that he was able to help through a lot of mind body approaches. But one of the fascinating things is he said so often people that had really gone through his program actually came to look upon their cancer as a blessing because
Hmm.
they grew so much personally through the experience. And he called them exceptional cancer patients. So, of
Hmm.
course, a diagnosis can't really, or anything for them, any stressor can't automatically cause a certain response within us. It always is filtered through our own consciousness. And so the key to stress, I don't like to say stress management, the key to stress relief is understanding that it's not what's happening to us as much as what we are making of it, the meaning of it, what we say about it, the thinking that we have about it. This is where we can really intervene. So we no longer have to see ourselves as the victim of circumstances, but rather understand it's really up to me. It's
Hmm.
my own internal interpretation. And so, in terms of what that means practically, uh, is we want to be able to really understand the fact that it's not our circumstances, the external things are not causing directly anything, but we are creating our experience. It can be, of course, a very terrifying circumstance. Of course, bad things happen, but how we experience it is really up to us.
Hmm. Yeah, very well said. Because yeah, two people can be in the same room having the same like experience, and yeah, they both react to it totally differently, and that creates their version of the reality. So so it's important for us to pay attention to our thoughts and how we our everyday thoughts, what goes on in our minds. So for example, and this is one that used to bother me a lot. I would be out in traffic. We're out driving, we're in traffic, people cut you off, that sort of thing. And it's like you can get really mad at those people, or it's like, oh, there's always somebody tailgating me, or and then you just get like really mad. Or you can look at it like, okay, well, I'm just going to drive safely. It's a beautiful day. Let me look at the beautiful mountains around me, and then you can totally turn it around. And then it's like, you don't even notice that person who cut you off. So, just as an example, especially because driving, people do it so much, it seems like,
Mhm.
uh, you know, so. And once I started doing that, it really got better. And I love to drive now. It's like, yeah, I don't mind driving.
Mhm.
Let me drive. So that's just one example. So, but for those people who end up turning it into a really destructive behavior, this is when it gets to be a big problem, right?
Mhm.
So what would you recommend for those people who are kind of at that extreme level and they just don't know what to do?
Well, what I've learned, what I'm experiencing now and working with people and all, and it really is based on the new brain science that is really clarifying many, many things about the way that habits form, the way that addictions form, the way they are being maintained, and the way to overcome them. But it's very important to understand that There are issues that deal with the formation of a habit or an addiction that often have to do with just us wanting to feel better. We want to somehow we're not in a place where we're satisfied with our life. We're looking to feel better. So we kind of almost innocently can kind of get involved in something that in the short run may give us some pleasure. But once a habit is formed, once there's actually a well-established habit, and that's where people are really kind of encumbered by their habitual thinking or behavior. Once they're really kind of, in some ways, it could be like an enslavement, certainly. And even the milder forms of it, it's just sort of a barrier to one's quality of life. Once the habit is well established, the prevailing belief out there, even amongst the professional mental health community, which of course is a wonderful place for the value that they can provide. But once a habit is formed, there's a prevailing belief that unless we delve deeply into the person's past, maybe even into their childhood, that if we don't really uncover the deep psychological, personal factors that existed or exist now with that person, that we really can't expect the habit or the addiction to end. And that turns out not to be true. Once a habit is established, once an addiction is there, the hidden key to being able to end the habit is to understand what I call the anatomy of the habit. The anatomy of the habit, it's always, no matter what form it takes, it's always preceded by an urge, a feeling, I need to think this way, or I need to act this way, even though we don't want to. And so if we understand how the urge is created through the nervous system, and especially the brain, and now we have a lot of insight on this, we begin to see the urge in a more accurate way, in a more truthful way. And as we see it as it truthfully exists, it loses a tremendous amount of its power. And the brain science is really helping us to understand this. So depending on if you want me to go further, and maybe you want to ask.
That sounds really fascinating, because you're right. I think a lot of people do think that they have to dive into, looking at the past, and that's why they, I mean, all of those practices, the psychological practices that have been going on for centuries, we feel like that's the way we need to go, but it sounds like we really don't need to do that. So
Well, not if we want to just end the habit. Now, once we end the habit, by dealing effectively with the urge, which is what my programs are always about, how to do that. But once that's done, it's not as if life then becomes perfect for us. We're in a position then where we have our challenges, we have our personal issues, but we're not encumbered by the habit. So we can get on with our life. We can get on with improving our life circumstances. We can advance with regard to our spiritual, mental, emotional well-being. We can do all of these things because we no longer are kind of enslaved to this sense that we've got to think in a certain way or act in a certain way because of the habit, being driven by this urge or craving. And that's very exciting because we can help people. In my work, I do volunteer trainings and educational programs for St. Matthew's House in Naples, Florida. They have a wonderful drug and rehabilitation program. And I work with their staff, with their administrative staff. I also work with their programming staff, and of course many programs for their residents, the men and women in the program. And we're able to, once we can have people see that the urge is the key to at least ending the habit. then they can move on with their life and deal with all the other things that, maybe really there could be a lot of personal growth issues, et cetera, et cetera.
Yeah. Yeah, it sounds like even just changing one little habit could really open the door for a better life in all different areas of your life. So it sounds to me like it's very well worth it to actually take a look at your own habits and asking yourself, is this habit helpful or is it harmful to my overall existence? And it also sounds like you work with all types of different habits that maybe like I've known people who are afraid of just going out in public. I mean, stuff like that is a pretty big deal because it can restrict you in so
Mhm.
many ways. Like it just puts you into this little box, and you can't even function in society, you know. And there's no reason for that. So yeah, this is really refreshing. It's like, okay, yeah, we don't have to go live through our childhood pain anymore. Like how great is that?
Mhm. Mhm.
Yeah, that sounds
Right.
amazing.
Yeah. Well, and it, whatever form that habit takes, whatever expression. Now, sometimes it could be a substance like drugs or alcohol. Sometimes it could be just, um, you know, um, gambling. It could be an internet addiction of some type, pornography. I mean, there can be a lot of different things. Then there's the habits, kind of like what you're alluding to. I was working with someone who had a habit of always kind of seeing the worst in her husband. She didn't think of it as a habit. She just thought that's the way he is.
Mm, right.
And she always had the reasons why she disliked him. Uh, and as we came to understand through a process where she could see that her experience of him was, first of all, again, up to her. And then that she began to, again, over time, it's a process to see it as a habit of thinking, to be thinking of him in a certain way. And then she could actually locate a certain kind of urge to do that. Then with the brain science that we now know that this is really, it's being just generated from a part of the brain, from the lower brain. See, there's like the higher brain, which is all of our higher consciousness, conscience, judgment, um, altruism,
Mm,
love, unselfishness. All of these higher qualities are associated with the higher brain, and it's higher in the skull, cerebral cortex. In the lower brain, the brainstem, this is the survival mechanisms. They kind of call it the, I mean, from an evolutionary point of view, this is kind of like the reptilian brain. It's like
mhm,
all it's concerned about is survival. And,
right.
and it works based on patterns. There's no rationality. It just works on patterns. So by repetition of a particular activity or behavior, we reinforce the circuitry coming from the lower brain. And often it's associated with guilt and fear and things which actually create a kind of inflammatory state that weakens the higher brain. We lose, as we become more and more addicted, we lose our ability to make conscientious decisions, to use good judgment.
Mm,
Um, and so but fortunately, and this is a concept called neuroplasticity, the brain is not static. It can heal. We
mm,
can reduce the negative circuitry and the signals coming from the lower brain and enhance and promote that healthy circuitry in the higher brain. Now we need both. It's all been created, but it's got to be in balance.
right.
So survival has to be based on higher spiritual and emotional and mental qualities. So it's all very fascinating. But the point is that practically speaking, we can really, really help people to end their habits and addictions by just learning how to be able to dismiss the urge.
I love that. So, how long could somebody reasonably expect to take to go through this process and actually see a result? Like how much time does it take?
Well, really, that depends entirely on the person. It really isn't a matter of how, I mean, once, if there is like, let's say drugs and alcohol, so there has to be a period of detoxification. But then dealing with the tendency to go back to that destructive habit or in any other form, uh, whatever it is, it doesn't matter the extent of the unwanted habit or uh, the degree to which one is experiencing it. It well, what it is, it comes down to the individual, how soon an individual can have the insight over what is actually going on. That that urge, which often has a kind of voice associated with it, it's like, and because we experience that kind of voice within our own consciousness, we can feel like, oh, a part of me doesn't want to take that drink, but another part of me does. I mean, there's a sort of a voice on each side, and we just experience the conflict between these kind of two impulses, two voices. And that's why willpower is so ineffective, because we're trying to fight our own biology. We're trying to, in a sense, we're fighting ourselves. But the truth is, the impulse, even the voice from the lower brain, is just a kind of mechanical machine generating these impulses without any kind of rationality. And the more we see it for what it is, it's kind of a neurological garbage. The more we see it, the more we don't identify with it, even though it's within our own consciousness. We see that it's not us. We can then kind of very effectively begin to dismiss it. Now, as we dismiss the urges, then we don't act on them. Then those negative destructive circuits diminish. And eventually there aren't any more urges because they're not being repeated, they're not being conditioned, they're not being programmed in the brain. So in answer to your question, it really comes down to the individual, how quickly they can, this is not intellectual understanding, you see, this is like insight.
Yeah.
Insight to really get it. Wow, that voice is kind of like, they even call it in some approaches call it the addictive voice. And we can misidentify with it and actually think it's us. We begin to realize it's not. It's kind of like a backseat driver that's screaming for us to go through the red light. It screams and screams, but it has no control over the actual movement of the car. That's us in the front driving. This backseat driver, once we realize it's just the backseat driver, we don't have to listen, even if it's screaming.
Yeah. Wow, that sounds great. So how do people work with you, and what kind of programs are you offering? Can you tell us a little bit more about that?
Well, what I have is a program that includes video tutorials and PowerPoints and worksheets. It's an online program which also includes personal one-to-one private sessions with me. It's basically a 3-week program. The best way I would suggest for any of your audience that would be interested in learning more about this is get my special report. It's a free report, and they can get that by going to www.enddestructivehabits.com. enddestructivehabits.com. And they'll be able to get that special report at no charge, and that will really give more information and also introduces the details of my program.
Okay, well, that sounds terrific. Thank you so much for coming on the show today. I greatly appreciate you and all the fantastic work that you're doing.
Oh, and I applaud you as well, Cynthia. Thank you so much for all what you're doing, being of help to people, and and also the opportunity to be on the podcast today. I just want so much to be able to be of help to people and have them understand what what possibilities there exist now for them to achieve freedom much more quickly and easily than they might have otherwise thought. Thank you.
Yes, thank you. And remember, everyone, that you can live the life you want, regardless of your story. So thanks for joining us today, and have a fantastic day. Thank you for listening to Love in Your Hands. Please rate, review, and subscribe to show your support. This podcast is sponsored by loveinyourhands.com, the place to find the secret ingredients to your soulmate. Start your free Soulmate Connection membership today using the most innovative and accurate algorithm to match you to potential long-lasting love, all at loveinyourhands.com.